stand for any reason or stand for that long of time, they may not do the feet sensor ones, or they may do them sitting down at the edge of a chair. This is where communicating with an instructor or therapist or seeing an instructor or therapist for this program is a best way to do it, because they can instruct you how to best accommodate this program to work for yourself. And they can also alter the program to be able to best fit your needs. Like I said, you can do it yourself through the gaming methods, but it is best done in a therapy setting or an instructor setting. In relation to the universal design for learning, is learning can be affected by different learning disabilities, deficits, or even brain damage. IM therapy uses technology to provide improvements in systems that the positive uses of the therapy can cause an increase of the learning after the therapy is completed. These include things like attention deficit hyperactivity disorder, and the corresponding research for that is Fox and Lear, 2018. Sensory processing, this can be corresponded with the research of Ritter and others in 2013. Developmental learning disabilities, this can be correlated with Cosper and others in 2009. And autism, correlated with research done by Song in 2013. Audio processing disorder, coordinated with Chakraborty and others in 2017. These are just a few examples of the many different kinds of disabilities, deficits, or damages that may inhibit someone's learning. The goal of IM therapy, beyond just the attention span, is very broad. It wants to improve life in any way possible that it can. And when you improve things such as memory, attention, and ability to time manage, you're also going to coincidentally improve someone's ability to be able to learn, because now they feel that they can pay attention longer, or they might remember more. There is also a very large range of diversity when it comes to IM therapy. We see that this therapy doesn't just benefit those with a learning disability, disorder, or even damage to the brain or other areas of the body. We see that in older populations, just like Trujillo in 2017 studied, that older populations in itself benefited greatly from this therapy just because of the decline of the motor skills that come with older age. A lot of individuals in this group of testing identified as being neurotypical. Therefore, they did not have any disability besides their age process that would have inhibited their learning from a current psychiatric standpoint. But they still saw so many benefits in memory and their motor function that it showed that even people who don't suffer from anything that may inhibit their learning can still benefit. We also see that it has a really good benefit in children, as Ritter and others 2013 showed. They took, again, a population of students that had a very wide range of intellectual ability and tested them, and it showed that no matter what the intellectual ability was, that there was an increase and an improvement in their functionality in school. Another really big portion is I talked about damage when it comes to learning. What does that mean? Brain injury survivors. Sly in 2010 studied stroke patients. Strokes are not only affecting the brain, but they also affect the rest of the body. Someone may have motor deficits for short-term or long-terms, and it showed that IM therapy was used to help them. Trauma. Nelson and others in 2013 studied soldiers and veterans who had blast-related trauma who underwent IM therapy and showed significant results in positive results in their ability to just live life and function after these traumatic events occurred to their brain. They saw improvement not only in their motor function, but their memory, their ability to take care of themselves, those types of things. And obviously that varied depending on what their relationship to the brain injury was in relationship to the blast. Lastly, Lau and others, 2017, studied central nervous system rehabilitation, which can consist of many things. But what this individual and others did is they looked at how can we use this research in rehabilitation. And what they found best was in cases of central nervous system related injuries. So we see that there's a very large population that can benefit, and there's very easy and accessible technology to use. However, with anything technological, with any form of therapy technological, especially in the United States, it is not always feasible to access it through healthcare. Not all insurance plans cover therapy, let alone IM therapy. The other sad thing is that it's not affordable to everyone. So we do see that downside in the accessibility, but what we do see is the benefit to anyone that can get a hold of this kind of therapy. And we know that as different things benefit and grow, that they may become more easily accessible. So if we could put this in elementary schools, in different programs, such as there's programs for people who go down and do speech therapy. If we could get this kind of technology in those schools, it could benefit anyone. Like those kids who go down for the speech therapy, like the kids who are struggling to read and may need a quieter place, anyone can benefit from this. It's just the issue of getting it more accessible. That's a little bit of a challenge right now. However, with more and more psychological benefits progressing with this and more occupational therapists using this as a form of occupational therapy, this technology is becoming more and more prevalent and recognized by insurance plans. And even though not everyone in the United States is insured, most other countries have universal health care, which would be a great benefit to them. I talked quite a bit about my various research that I did study in order to be able to prepare best this conversation. Most of my information comes exactly from the Interactive Metronome website. That was not research-based. However, the website even includes different articles that you can look at with their research. I chose to go off of their research so that it wasn't skewed in any way. And these are half of the first references I had, and this is the second half. If you have any questions, please leave them below in the Q&A box, and I will be happy to respond. Thank you so much. Have a great day.